If you've got one-sided back pain or sciatica, you don't want to miss this video.
Oh, actually, we're going to jump back in time, no pun intended. We're to one of our most popular videos that actually shows a number of options to treat back and sciatic pain.
But make sure to stay tuned because afterwards we will be back in the present time to show you a powerful stretch.
All right, I'm all ready to go. We're going to jump into TARDIS, and
Doctor
get
Who.
back in time with Bob and I. Here we go.
Woo, woo.
Bob and Brad, the two most famous physical therapists on the internet.
To show some 1-minute sciatica exercises you can do for pain relief. These actually can lead to total relief too, but it's just kind of a quick start.
Right.
So
we've got a number of them here. Not all of them might work, but more than likely you're going to find one or two of them that are going to give you some good relief.
Exactly. So let's go ahead and start off, Brad. The first thing, well, you know, what we're trying to do, Brad, is we're trying to, right away as I stand up, Lonnie goes, sit back down.
We can't see your head.
What we're trying to do is a lot of times the pain is going down the leg, isn't
Exactly.
it, Brad? Can you turn around once, Brad?
Sure.
And face. So a lot of times the pain is in here, and then it'll go down one leg or the other leg, and it'll go down to the butt, then eventually go down to the back of the leg, maybe the calf, and maybe even to the foot. So what we're trying to do with these exercises is we're trying to get that pain out of the leg, especially out of the foot and calf first, and then out of the thigh, and then out of the butt, and then usually that's the progression.
Right,
So that's what you're looking for.
From the foot up.
So this is my painful side. I don't know if you can see that blue on here. I should have probably took a red color, huh? Brad, do you want to hand me those pillows there?
Yep.
This is often the first step that we do with people when they're having that pain, is we're going to have them lay on a couple pillows, because some people can't lay flat. So all you're going to do for 1 minute is lay like this. Kind of the pillows are underneath the pelvis, underneath the back, and
sometimes, can you lift up, Bob?
Sure.
Sometimes I'll put the pillows this way. It all depends on what's more comfortable for them. So this way or this way.
Right.
And I think some of these people will be the kind of people that have a hard time straightening up. And
Exactly,
They
Brad.
find that they're walking forward with that back pain.
That's right. And so this is the progression. So you can stay there for a minute, then you might just take one pillow out, Brad.
Right. And you might not be able to be on your elbows. You may have to.
Yeah, you'd be down like this.
Yep,
I'm
down
sorry.
like that.
Yeah. And then after another minute, you take this one out.
Right. And I've done with the patients many times where I'll start with the two pillows.
Yep, I have too.
And then they say, oh, it feels a little bit better, or a lot better with the pillows. And you give them, that might take a minute or two, and then you take one pillow out because it starts feeling better, and then you drop it down just like Bob is here.
So now, you know, some of you might be able to skip to this step right away, Brad.
Exactly.
Some of you might be able to get, and so we're going to have you lay this way for a minute. Now after that minute, what you're going to try to do is now you're going to try to go prop up on your elbows for a minute.
Right.
So again, maybe you can go to this right away too.
Right.
Some people can.
Right. You may go up and say, oh, that kind of hurts. You may have to go back down, but that's okay.
You're looking at what the pain in your leg is doing.
Exactly.
If this is making the pain in your leg worse, or it's making it go down even further, this is not the right thing to do, then we're going to have to try something else.
Exactly.
All right, so let's say this worked out fine, Brad. Now we're going to go ahead and jump into the press-ups.
Sure.
You can do these, you know, for a minute if you want.
I just did these with someone last week, and he couldn't do the press-up. He only got about this high. He'd get up, not even that high, Bob. He was out to here, and he was doing baby press-ups. He says, it hurts. Well, I said, just do some more, and by the time he got to 10, he was up to here.
Okay.
And the pain started going out of his foot and out of his leg. It was a good day.
What you're trying not to do is do this. You're not trying to lift up your pelvis. You're keeping the pelvis down. You're gently working it this way.
That's a good point, Bob.
All right, the next progression, Brad.
Wait, Bob, before we go on.
I knew you were going to do that, Brad, because I was ready for it too.
There's new people out there that have not seen our channel.
Hi, welcome to our channel.
Bob and Brad.
Yeah, and today we're going to, want you to encourage you to go ahead and subscribe to us.
It might be here.
Yeah, some people said it's up there.
I don't, wherever this is, subscribe button
it's
is.
on the screen, but take a minute. We upload a video every day, and it's all on how to stay healthy, fit, pain-free. Is that good enough, Brad?
Perfect.
All right. So after the press-ups, let's say the press-ups don't work, Brad. You tried half press-ups, you tried, and it's just still giving you trouble.
These are the stubborn ones.
Yeah, and now the pain is on this side.
Yep.
So now what you're going to try is what we call the banana.
Sure.
So I'm going to move my butt over this way, and I'm moving my legs over this way, and my upper body over this way. Does this all make sense, Brad, or not?
If you look at it from this angle, we call it the banana because his body is shaped. If you look at it this way or from the top down, he's curved, and his hips are over to the, in this case, the left. Usually if the pain is on the right leg, you shift the hips
to the
opposite.
left,
Yep.
So my feet are to the right, my shoulders are to the right, my hips are to the left.
Right, make that curve going
Yeah.
in.
Now in this position, you can just lay here for a little bit. You might get up on the elbows.
Exactly.
And you might also try the press-ups.
Press-ups.
Yeah.
And what's
Again.
going to guide you is if the leg pain is getting better, then you go with it.
Yep. Now let's say you find out this works for you. This is the thing that you can do throughout the day for 1 minute. I mean, that's the idea behind all these. If you find out the press-ups alone work for you, go ahead and do
Right.
those for 1 minute.
Right.
You can do those every hour, Brad.
Yep. I had a patient, I always got to tell this story. He was an excellent patient. He had his own business. He needed to get better fast. He and his wife went out to Las Vegas, and he was having this problem. He was getting better at the time. I said, do him every 1 to 2 hours in Vegas in a shop. His wife was shopping for some trinkets or whatever. He's down on the floor in the
shop?
Yes. He went to a place where there wasn't many people, of course.
Oh my God.
He got better, though.
I've had people where I've had them take cardboard to work though, and they worked on a shop, like a manufacturing
Yep.
floor, and they would go down
Sure.
and do it.
If
And
you
they
want
wouldn't hesitate.
If it works, you want to get
Yeah.
better, you'll do it.
Now, when we say every hour, we know you may not be able to do it every hour, but if you do it 5 to 6 times a day,
Yep.
that's really helping a
Yep.
lot. All right, the next one, Brad, if this one doesn't work, the banana, boy, we really got some beeping going on there, don't
Yeah.
we? We're gonna go ahead and put the towel underneath the thigh here.
Yep.
So this is instead of the banana now. If the banana didn't work, you might try putting a towel right underneath the pelvis here.
Right. So what that does, it tilts the pelvis a little bit, and it changes the force on the back. It is going to take that disc, that bulge in the disc, and get it out of the way, so to
Right.
speak.
So, and then again, with this works, then you can go ahead and do press-ups.
Right.
We're throwing a lot at you here, but try these step by step. If you find one that works, that's the one you're going to do every day.
Right.
All right, the next one that you may, which is similar to this one, Brad, is actually the roadkill.
Right.
So-
this is kind of an unusual name. I'm not sure how it got to be called
Well,
this.
you look like roadkill when
I
you
guess.
So I'm bringing just one leg up there, one knee up like this.
Yep.
So, and again, I'm going to lay here. I'm going to see if this, and you had a patient that just recently worked
Just
for.
recently, but yeah, I use this one over the years a number of times with success.
Yeah. So if this gives you the relief, again, less leg pain, less back, not less back pain. Normally it's usually less leg pain.
Right.
Eventually less back pain, and then you can go ahead and do press ups. Even in this position?
Yeah.
Or don't you normally do that?
No,
Brad?
no, I'll have them do it for sure. But it's just kind of I always tell a person that it's kind of a weird press up because you're not going to go as high, but you still follow the same rules. If the leg gets better, it's okay.
Okay. All right. This one, Brad, is a little more advanced. Let's say a lot of those aren't working for you. You want to try something new. I'm going to grab a pillow here, Brad.
Okay.
This is a mulligan technique, and I don't know if they do it in McKinsey too, but here's my involved side. I don't know if you can see that. Here's the side.
Yeah. This is the
So,
leg.
yeah. So we're bringing it up like this, Brad, and we're going to actually twist over a little bit towards
Yep.
the involved
Yep.
side like this. And you're going to see if that gives you some relief.
One little trick, I don't know if you do this one, Bob, but I'll have it, put your foot down, just lift your butt up and shift it that direction a little bit. Now set it down.
And then bring them up and over.
And sometimes that's tolerated a little better and it works a little better. It depends on the individual.
Oh, thanks for the little hint, Brad. I didn't know that one, so nice.
It works for me sometimes.
All right, so you can give that one a try. A different one, a little variation. This is kind of more of a sleeping one to help you sleep at night.
Yep.
You want to grab one more pillow,
You
Brad?
bet.
So you're going to lay on your side that's not painful. This is going to be hard for me because I got my mic here. I'm going to switch.
Oh,
This is,
it just went down the other leg, the
Yep.
reverse sciatica syndrome.
so
We've
I'm
never
going to
heard
lay
of
on
that
the
one.
side that's not painful. The painful side is on the side up.
Yep.
So I'm laying on my side here, and I'm going to go ahead and put just 2 pillows underneath the calf, underneath the ankle and the
Yep.
foot. And believe it or not, this often, lay here for a little bit, people often find out that this gives them some relief.
Right. Yeah. I haven't figured it out yet. But if it works.
I think it brings it back up into, a little bit of
Sure.
arching here that
Yep.
seems to take it away. This is another one that we do. It's called sciatic nerve flossing, Brad.
Yeah.
So again, since we got the painful side here, this is something you want to be very careful with. The sciatic nerve is very tender, and you don't want to go crazy on this. I usually only have people do this once or twice a day.
Right. Nerves aren't like muscles. If you stretch them too hard, it becomes very uncomfortable.
This should not be painful, Brad, when you're doing this. Yep. So what you're going to do is you're going to go actually bring the foot up and bring the toe toward you. But while you do that, you actually bring your head back like this, Brad.
Yep.
So the toe goes toward you, the head goes back at the same time. Then you go down, and the head goes down.
So the bend in the knee, and then the toe points down as well.
What you're doing is flossing the nerve. So down, toe goes down. Up, head goes up, toe goes up. Down, toe goes down, head goes down.
Yeah, you're just trying to loosen the nerve up.
Yeah, you're flossing, especially if there's some scar tissue on it that seems to help decrease that. So, well, Brad, those are it. We made it through the 10 already.
Whoa! We're back.
Well, you're back. I've been here.
That's right. Back in time. Now, we are going to show 3 options of one-sided hanging to help the same one-sided back pain or the sciatica. We're going to do it because if you don't have a pull-up bar, or if you don't have a stick, you could use a door. One of the 3 you should be able to do at home.
So oftentimes with one-sided back pain, what is happening is you have some type of disc bulge going one way. So we want to open up that side of the back. So that's why we're just doing one-sided stretches. I'm going to turn this way just for camera purposes. We're going to say my right side is the painful side. I'm going to reach my hand up to the top of the door frame. My palm is facing away from me. And I'm going to bend my knees and lean into the door, and you're just going to feel a nice stretch, decompressing that spine, hopefully getting some of the compression you're having on that nerve off of there. So do this for 15 to 30 seconds. Try to breathe and relax, and then come back up. Now, you can certainly do this from a pull-up bar or hanging handles like Brad is going to show. It's the exact same concept. You can even do it with both arms if you have a pull-up bar and feel comfortable.
That's right. I just want to make sure you understand when you're doing this, if you get relief as you're doing it, it's a good sign. On the other hand, if you start putting weight down and you get some sharp pain and things are getting worse, then stop that. That is not for you. And also up here on the door frame, make sure that your trim is well put on there. We've had a problem here once where it was not nailed in properly, so that's a little thing to be.
Do you want to show the wall version?
Yeah, be aware of. If you do have a pull-up bar or a hanging handle like this, and this is the side I have the pain on, this actually works better, I think, than the door because the door is limited. So you're not going to hang your whole body weight without touching the ground. Start here. The pull-up bar or the handle should be low enough so you can simply lower your body weight by the control of your knees, stretch, and then I'm actually going to lean into the wall a little bit so we get a nice one-sided stretch. There we go. And if it feels good, you can put more weight. If it doesn't feel good and it's causing some pain, you may have a shoulder problem. That might be limiting it. So you got to listen to your whole body. You should just feel a nice stretch. And if the pain down the leg gets better, that's a really good sign that this is going to be something you want to work with. But don't go from partial weight bearing, and if it feels kind of good, to letting your whole body. You have to go through this slowly and take your time with it day by day. Mike, did I miss anything?
You can show with 2 handles if you want, but it's not necessarily one-sided back pain. We can help with other issues with back pain. So same concept, but you just use both hands.
Right. And if you have that pull-up bar that's going straight across, you're going to grab it with both hands in here. And this is actually a stretch I do for my back and shoulders on a regular basis. I go just exactly like this, back up against the wall. That's really handy. And I slide my back down so I'm not doing it fast or abruptly, and slowly. And you may only go 50% of your body weight or so. My feet are firmly on the floor, controlling it very well. If things feel really good and you've done this for a week or two, you may want to go with the full body weight. I do that, but I've been doing this for years and I feel very comfortable with it and it works very well. Now, if you just don't have this, then you can go to what Mike has is a mop handle, or you can use a booyah stick or a piece of doweling or PVC pipe.
So you can do this standing or seated. This is the exact same concept. So with all these, just pick which one works for you. You don't have to do all three. Slide your hand up as far as you comfortably can. Hopefully you have good shoulder motion.
Palm away from you.
And then palm away from you. And then you're going to lean into that side. And this is, again, going to kind of decompress the spine. Obviously, if you're sitting like I am, you may not get as much decompression as you may with standing or even hanging. But we realize some people don't have a pull-up bar or they're too short to reach the top of their door frame. So this is another option you can try.
And if you're doing it standing like this, the important thing is that the stick does not slip around on whether the chair or the countertop. Simply take your shoe off like this, put it in there so that it does not slip. That's a really nice way. Your hand shouldn't be slipping up there. Hold a good tight there. And if you want to get a little more aggressive with it, simply let your knees flex or bend. Wow, there we go. I'm getting more aggressive. It feels good, though. If it doesn't feel good, sharp pain, stop. Oh, but this is good for me.
So give all those tips a try from the old video and the new video. See which ones work for you. If you want to check out more videos on sciatica, click the video link on the screen.
Yeah, and if you want to take a trip in the TARDIS, that's
call Doctor Who.
Yeah, call Doctor Who. We're not.
We're friends.
We're not authorized to do that with anyone else. Have a good day and be careful.
Bob and Brad, the two most famous physical therapists